President Trump and Health Secretary Robert F. Kennedy Jr. have released the final version of the Make America Healthy Again roadmap, a plan meant to target food, vaccine, and chemical safety in children's health. The MAHA roadmap, officially known as Make Our Children Healthy Again, was published on September 9, 2025 by the White House under the direction of Health Secretary Robert F. Kennedy Jr. Its stated goal, to address rising rates of chronic disease among U.S. children, focusing on nutritional health, chemical exposures, vaccine schedules, and oversight of drug and food marketing.
There's never been a president in my lifetime that is more willing to challenge businesses when they overreach. It was more fearless of challenging entrenched interests in our society. And so many times I've had discussions with him about a certain injury or illness, and he'll say how unpopular it will be if we talk about the solutions, which are going to hurt certain businesses. And he said, I don't care. He says again and again, I don't care. This is children. We need to save the children. A lot of these 128 recommendations are things that I've been dreaming about my whole life. I've been working for in congressional campaigns and presidential campaigns for other candidates. And they get into office and they say, well, we just can't do it. A lot of these things are things that I never thought about.
But there are real scientific issues that need to be addressed. Why are autism rates going up so quickly? What can we do about it? What's the answer for type 1 diabetes for kids? What are the long-term effects of the rising use of antidepressants in children?
The strategy includes updating the dietary guidelines for Americans, defining ultra-processed foods, reforming how the FDA approves food additives, and encouraging removal of artificial food dyes. On vaccines, the roadmap calls for modernizing vaccine development, reviewing and adjusting the childhood vaccine schedule, ensuring vaccine safety via transparent gold standard science, and addressing vaccine injury reporting. The report mentions studying chemical exposure in children, including herbicides and pesticides such as glyphosate, and promoting techniques like precision application of pesticides to reduce chemical use. Despite earlier warnings from public health advocates, the final roadmap does not propose new regulatory restrictions on pesticide use. Instead, it aims to accelerate EPA reviews of new chemicals and rely more on non-animal testing methods for evaluating risks. The plan includes increased oversight of drug and food marketing, particularly targeting children via social media and telehealth companies. It also includes establishing a data platform at the NIH to conduct real-world studies of autism cases and other childhood conditions. Some public health advocates and former MAHA allies have criticized the report for being too lenient toward the agriculture and pesticide industries, saying it avoids tougher regulatory measures. The roadmap reflects industry-friendly policies, such as speeding up pesticide approvals, reducing emphasis on animal testing, and maintaining existing pesticide regulatory frameworks rather than tightening them. Let me know your thoughts.